Rudolph, report to the stage. Welcome back. How are things going so far? So you like the information that you're getting? Yay! All right. So if you are the primary caregiver of an aging loved one, and that can mean you're taking care of their affairs somehow, some way, please raise your hand. Wow. God bless you. We know it's a lot of work. Thank you all for being here. The only thing I wish I had offered you guys, especially the primary caregivers, is a massage therapist. Maybe next time. Now I'd like to introduce you to our second professional panel and more of my village, the support services. Please introduce yourself, grab the mic, make sure you talk close to the mic. Name, title, company.
Hi, my name is Lynn with Simply Grab Bars. We provide professional grab bar installation.
Morning, I'm Craig Cowart, the State's Veteran Service Officer with the Florida Department of Veterans Affairs.
Hi, I am Lindsay Remington. I am from Senior Benefit Solutions. I am a licensed insurance agent.
Good morning, I'm Kevin Hernandez, an attorney and counsel at law at the Hernandez Law Firm, and we provide estate planning and elder law services for our clients.
I'm Jim Rudolph. I'm the owner of Veterans Funeral Care.
Good morning, my name is Natalie Lemke, and I'm the owner of Seabreeze Adult Day Center in St. Petersburg.
Awesome, we've got such a great group. The first panelist is me. So I couldn't convince my nurse, Lori, to sit on the panel. So bear with me. I'm going to ask myself the questions, but I'm not going to move from here to the chair, okay? So what is Navacare? We help families navigate assisted living, memory care, and independent living in senior communities. We also help people, if they're not ready to make those transitions to assisted living, we help set up in-home care services. We are not pushy, salesy. We're not trying to get somebody in assisted living if that's not where they want to go. How much do you charge families to help them find the right community for their loved one? You ready for this? Big fat zero. It's a free service. So we are like a realtor for assisted living, full disclosure. When you choose the community for your loved one to move into, we are paid by the community. We know all 145 communities in Pinellas County, and we stay in those buildings. We stay in touch with what's going on in each building. We monitor the care and violation history with the state. We monitor change in ownership, leadership changes, director of nursing changes, etc. So how does it work? We do an intake. We complete an assessment, and the two of those, we ask a lot of questions. So what we're looking for is we want to know, what are your loved one's care needs specifically? What are their or your geographic preferences? Are there any spiritual preferences? What is their personality type? Are they an introvert or extrovert? That really matters when placing someone in a community. And last but not least, what is the budget? So we have a nurse, Lori, who she's way in the back. And she does most of our assessments. So again, we ask a lot of questions, we listen, we find out what's important to the family as well as the loved one, and then we narrow that down to the communities, and I call them communities, not facilities, just because facilities seem so sterile. We narrow that down to the communities that actually meet all the criteria, and we send you those recommendations. From there, you guys narrow it down. We can talk specifically about the pros and cons of each community, and by the way, we're gonna tell you the good, the bad, and the ugly. We're gonna tell you what we know about them, and it's your decision to make. I've had families come back to us and say, hey, I saw this community. What do you think of that community? You didn't send it over. I was like, well, I haven't referred to their assisted living for a number of years because the care standards are not what we feel comfortable referring to. So, not that you can't tour there, and you can certainly choose to move in there, but that is absolutely your decision, and we're just going to educate you on what we know. We are in and out of the communities intentionally. We pay attention to the details. So we have a 90-year-old, very spry young man, and he is still driving and very active in the community and wanted to move into an independent living community. Well, actually, he wanted to move into assisted living, so we did a combination of the two. But he's very active, so I could not put him in a community where there are, yes, 90-year-olds, but if it's a little lower vibe, a little sleepier, he's not going to do well in that environment. He needed a special vibe. So that's the other thing we pay attention to, the demographics. Who is in the community so that we can recommend the right fit? We get asked a lot, what is your favorite assisted living community? We don't have a favorite. It is based on the client's need. So who do we represent? We don't represent one particular building. We represent the client. It's what is best for the client. If somebody's on oxygen, if somebody needs help with a colostomy bag, if somebody needs memory care, we help you guys determine that. And people ask all the time, how do I know what they need? That's what we do. So we can do an assessment, we make a recommendation, and typically, just so you have an idea, in assisted living, more than 75% of the people in assisted living have some form of cognitive impairment. Whether it's dementia or otherwise, there's some form. Because someone has been diagnosed with dementia doesn't necessarily mean that they need memory care. For us, memory care is normally one of two things. If they are an elopement risk, like if there's exit seeking, they want to get home, to their home from when they were maybe a young child, that is an automatic memory care. They need to be in a secure environment so we don't have a silver alert, right? Second is if somebody needs prompting and cueing for everything. Say, for example, when they get up in the morning, somebody has to be there to remind them, hey, let's get you to the toilet. Let's wash your face. Let's brush your teeth. Let's go get some breakfast. If they need that level of everything as a cue, that would be another recommendation, typically, for memory care. And just know, assisted living is not one size fits all. It just doesn't work that way, and that is why the initial assessment is really important. The other question is, we get a lot. What if my loved one wants to stay at home? Well, great. Then we'll help set up some in-home care services to keep them safe at home. Oftentimes, the amount of care that's needed, they may not be able to afford in-home care services. So in those cases, they may have to transition to assisted living if family isn't able to supplement the difference. Does Medicare pay for assisted living? What do you guys think? No. So assisted living is paid for private pay, long-term care insurance policy. If you were a veteran or your spouse was a veteran that served during wartime, there are benefits for that, and you're going to hear more about those details. And then the last but not least is Medicaid. Medicaid does not pay complete all expenses in assisted living. It pays a portion of that. There are some online companies that have a different business model. So if you are looking up an assisted living near you because you are looking for something for your aging loved one, I would highly recommend that you utilize a company like Navacare to help you navigate through that process. But if you decide to do it on your own and you go out on the internet and you're searching for the community, say, that's next door to you, and you search on that, be very careful, because you'll get a form and you fill out that form, and what happens, and it's happened all too many times to clients that we have gotten, They call us, they're so frustrated because they've had 15 phone calls from communities because that online company that they filled out the information for, they thought it was the local community, but it really wasn't. They send their information to a bunch of communities, and I'm not exaggerating when I say it's 12 to 15 communities. Get a phone call from the marketer of each of those buildings. And as if you're already not stressed enough, your stress goes through the roof at that point. So I would advise, be super careful if you fill out anything online. Make sure that you're on the website you think that you're on. Look up at the domain name and make sure that it's the company's website. Another question that we got asked is, where would you place your mom? Well, any of the communities that we're making recommendations to is a place that I would recommend for my mom if she were in the same scenario. So again, we have to go back to, if my mom were in the same situation that your loved one is, these are the communities that we would recommend. Final words, be prepared. As I said, most people say, I want to stay in my home for the rest of my life. And I really hope for you that that works. If not, the only thing we are pushy about is go see what's out there. Have a plan. So if plan A is stay at home for the rest of your life, have a plan B. And we can help you with that plan B. We will schedule the tours for you. We go with you. We ask the questions that you may not even know to ask. We do all of that alongside you. And then at least you can walk away saying, you know what, if anything were to happen and I couldn't stay at home, it would be either this place or that place where I would like to go. And obviously, when that time comes, you want to double check with us at that point to make sure that that community is performing in a way that is healthy for you to move into that community at that time. So, okay, I'm done my part. Now, cool thing, there's something kind of in between here. So Natalie is the owner of Seabreeze Adult Day Center. How many people have ever heard of an adult day center? Okay, dang, that's a lot. So Natalie, if you could tell us, what is an adult day center and how do they differ from a senior center?
So, first of all, a senior center, right, is part of parks and recreation of a city. So, beautiful St. Petersburg has the Sunshine Center. So, I don't know if anybody ever heard of the Sunshine Center. Provides lots of activities, opportunity for engagement. They have some outings, great place to go and socialize. An adult day center is somewhat similar with the goal of keeping people socially engaged and active, but we are actually regulated and licensed through the Agency for Healthcare Administration, just like an assisted living would be. So our licensing allows us to provide care for people with higher needs. So somebody may have been diagnosed with a dementia, or they have Parkinson's, or they had a stroke, and now they need additional care during the day that a senior center really cannot provide. So that's where we step in. So we still want to be there for people to get out of the house and stay socially engaged, regardless if they need some assistance. And on the other side, we also are there for the caregivers who may need a break, right? They may be caregiving for all day long or week, and they may want to go back to work, but they can't leave their loved ones at home. We all know how important it is to stay socially engaged as we age, and that doesn't change if we do have a cognitive impairment or we had a stroke. It is still, the importance is still there. And that's what we provide, that social engagement, daily exercise, activities, just having a good time.
Wonderful. Does someone have to attend all day, or is there a minimum stay requirement?
No, so our center has no minimum stay. So some of the centers in the community, again, they determine it themselves. Some of them require 2 days a week. We don't have a minimum. We're here for the community. Our members do have a schedule that they may come Tuesdays and Thursdays for a few hours, and then we have some of our members who are there for 9 hours a day, 5 days a week, because they live with their children and they have to go to work. So it truly depends on what the need is for the family, and what they're looking for, what are they looking just for some social engagement, or can they truly not be home alone? And things change over time. Somebody may start coming to the center 2 days a week, and then they come 3 days a week because they have a great time. And then the neurologist says they can now no longer be at home at all, and so they end up coming more. The goal is for people to stay in their homes, in the community, as long as possible. And as we all know, as certain diseases progress, maybe Parkinson, and they need a lot of physical help that the family can no longer provide, even with supportive services of in-home care, then sometimes people do end up moving to a community where Mary Ellen would step in and help finding that next home that would be more appropriate for them. But as long as they live in their home, we are there, for them to provide the supportive service.
And how does one pay for adult day services, and is it covered by insurance?
So it is very similar to what Mary Ellen mentioned with assisted living and memory care. So the one is private pay. The other one is long-term care, private long-term care insurance, which some people have. It is Medicaid, as well as veteran services. They also provide funding for adult day centers. But in addition to those, there are a couple unique funding sources that are specific to adult day centers and also to some in-home services, which is their state and federal funded programs. Their goal is of these programs for people to extend their time in their homes by paying for services like adult day centers. So one is called Community Care for the Elderly, and the other one is called Alzheimer's Disease Initiative. And then we have a third one under the Older American Act. So these are some Older American Act is a federal funded program, and the other two are state funded. And that funding, these programs are managed by our local area agency on aging. So we have the area agency on aging for Pasco Pinellas. So they provide these programs. They do assessments over the phone, and then they refer people out for services. Unfortunately, like any of these funding sources, there is a wait list, but we highly recommend that people get onto those wait lists early on, okay? Because it could be a month, it could be a year. It all depends on the situation. But it is, many people don't know that these funding sources are available as well. So if you have any questions on that later on, please come see me and I can give you exact information.
So we were talking earlier about the caregiver getting a little frustrated, they're tired, they're exhausted. Adult day is a great idea, and it's minimal commitment, and you can try it out and see how it works, and you'll be surprised when your loved one comes back home, they actually sleep through the night because they've had a really active day, right?
Yes.
Speaking of active, what kind of activities do you do at your day center?
Yeah, ours specifically, I mean, I think I'm a true believer, obviously, of all adult day center. I think they provide a great service in the community, but we truly go above and beyond in our day center to make the days fun and active. But our activities are a mix of physical activity as well as cognitive activities and opportunities to socialize. So we'll do like 45 minutes of a physical activity, then we switch over to 45 minutes minutes of cognitive activity. We have live music, entertainment, lots of parties, and Marielle knows we do lots of parties. And we have people come in that do Zumba Gold, Movement Matters, so many, many, many different things. We do something for everyone, crafts, a lot of things. There is a stigma about adult daycare center. It's almost like people see it and they're like, oh my God, no, not for me, I don't need it, I'm not there, which understand, we are there for people with certain needs. But I think the stigma often comes from the term daycare or day center. So we associate it with children, and we don't want to be treated like children, which I totally understand, right? We have lived our whole life, and now we're going to daycare. I mean, I can't imagine anything worse. And then people don't want to be cared for because they don't think they need any care. So we stay away, unfortunately, because of licensing, for people to find us, you know, it has to have some day center, day something in it. But we really try to tell our families it's a social club. It's a social club for people who need additional care during the day and supervision. But in all essence, that's what we represent. And I think once people get away from that stigma of daycare, I think people have an opportunity to actually try it and enjoy it.
Well said. And if you guys want to have any idea of what they do, check out their Facebook page. It is entertaining. I love seeing what they do. They travel different places. They just recently did something about a beekeeper, and they dress up in costume. It's amazing. How about transportation? Do you guys provide transportation?
So our center doesn't, but I would say 60% of our members are transported by their families. But the other great resource you may not know about, Pinellas County is very fortunate to have a very, very robust transportation system for people with disabilities. It's called PSTA Access, if you've never heard of it. It transports people anywhere within Pinellas County for $4.50, and it's a door-to-door service. It's a really great service, and it's appropriate for people with memory loss, as long as somebody's on point A and point B to receive them and put them in the car. You know, again, if you want more information on that program, that has nothing to do with our center in particular, but for anybody in the community who may need that. Generally, when somebody is approved, there are no financial question asked whatsoever with this program. It is simply based on somebody having a disability. And it doesn't need to be a physical disability. It can also be like a cognitive, like memory loss. People, especially people with memory loss, once they're approved, they're usually approved for 5 years at a time. And it's a great service. So please, you know, check into that. And that's what our members use if they're not transported by their families.
Does somebody need to be registered at your center, or can they just drop somebody off?
Very good question. So it is not really a drop-off or drop-in service. Because we are regulated, and just like in-home care, we go through rigorous background checks and staffing requirement. So we have a particular staffing ratio that has to be observed at all times. And as well, we provide a hot lunch, an afternoon snack. We have to have a count, so we need to know who is coming for the day. In addition, the state requires that there are particular forms on file, including a medical file as well, because the people that we care for do have generally some advanced medical needs. So the state is very, very strict on what is required for us to have. So once somebody is registered, like we said, there is no minimum. They can choose the day. They can come one day a week. They're more than welcome to switch days when something comes up, a doctor appointment, or they want to attend a special event. They just got to stay in contact with us and let us know what's going on.
Terrific. And so if during the time they're there, are they provided meals, and how about medications?
Yeah, so we provide meals, so a hot meal. All our meals are reviewed and approved by a dietitian as it's required by the state. And we also can assist with medication. We have a registered nurse on staff, and so we can provide clients medication during the day, especially people who may have Parkinson's, who require medication throughout the day. So we can help with that. Not all adult day centers do, so if you look at a center in your area, you always want to ask them that question. It all depends if they have a nurse on staff that can supervise that activity.
Two-part, and they're not really related, so forgive me. How about toileting assistance, and how many people usually attend your day center during the day?
Yeah, so we, as I mentioned, we do provide care that is a little bit more advanced care that a senior center would. So if somebody may have some incontinence issues, we certainly help them with that. We help with reminders. We go beyond the reminders. So a lot of cueing and assisting that is very common, as Mary Ellen mentioned, that some people with memory loss need a lot of cueing as to what activity happens next, if it's eating and so forth. So we provide that assistance. And with respect to the question, so we currently have about 30 to 40 people who attend our center on a daily basis. So we have a pretty good group of people, all very lovely, social, and once they overcome the initial anxiety of attending a center and getting out of the house and being with other people, I would say 90% of the time they absolutely love it. And I always mention people, when they first start coming, they may come grudgingly, almost wearing pajamas because the family had to pull them out of the house and they didn't want to get dressed. And then after a week, you see them, they're starting to wear a new shirt, and then they're wearing makeup, and then they're wearing jewelry, and they all come just also put together, and it gives us so much joy to see how people blossom after maybe having spent a long time in their home and enjoying the companionship of people their age and in similar situations.
Yes, I love that so much. And can you tell us where you're located?
We're about 10 minutes from here, right up on between 4th Street on 9th Street. We're on 94th Avenue North in the Gateway area.
Awesome. Thank you, Natalie. Next, we're going to move on to Lindsay. So with Senior Benefit Solutions. Lindsay, do I have to sign up for Medicare when I turn 65?
So you do not have to you do not have to sign up for Medicare at 65. This usually applies to a lot of people that are still working. And so we just want to make sure that no penalties are being assessed if you do not have adequate coverage. But you do not have to sign up. It's not mandatory.
There's only one thing I didn't like about that is that I'm still going to be working at 65. I'm going to be working till I'm 85, I think.
Imagine how I feel.
How do I sign up for Medicare?
So signing up for Medicare, if you're already drawing your Social Security, you don't have to sign up yourself. You're going to be automatically enrolled. Now, if you have not started drawing your Social Security yet, there's a few different options to sign up. You can go on to socialsecurity.gov, so it's ssa.gov. There's an online application that you can fill out, or the other option would be calling the Social Security line. They walk you through the application. Same application, you're just giving the answers verbally, and they're signing you up.
Okay. How do I get my Medicare card?
So once you fill out your application, either online or over the phone with a representative from Social Security, you'll receive your card in the mail. Usually it takes about 3 weeks after the application's been filled out. And that applies for those who do not have to actively enroll themselves either. So if you're drawing your Social Security and you're automatically enrolled, still comes the same way through the mail.
Okay, all right. Do I need to sign up for Part A if I'm still working? And can you walk through the parts, A, B, C, and D?
Absolutely. So Part A is going to be your hospital coverage. Also applies to hospice, now since we've mentioned that today. And then your Part B is going to be your doctors, so anything outside of, being admitted into a facility. Part C is actually going to be Medicare Advantage. So when people talk about Medicare Advantage plans, Part C is equivalent to a Medicare Advantage plan. And then your Part D is going to be your prescription drugs. That's something that they've tacked on recently, so yeah.
And what happens if I don't sign up for any of those?
So if you don't sign up for any of the parts, really what we're looking at mainly is Part B and Part D are the two that are going to come with a penalty if you do not sign up when you are eligible. So like we talked about, you do not have to sign up initially at 65 if you are still working and you have adequate coverage. However, if you are retired and you do not have comparable coverage to Medicare, you need to sign up for your Part B and you need to sign up for your Part D because they do assess penalties at that point.
Okay, good to know. What happens if I cannot afford the premiums? Is there help?
Absolutely. So there are several what they call Medicare Savings Program options. A lot of them are state and federally run. And so you have to apply for them. They kind of goes through Department of Children and Families, so kind of like a Medicaid process, but it's specifically for Medicare. It will help with the premiums both for your Part B and then as well as the premiums associated with the specific plan that you would be on. Some of them even help with co-pays and for medical services as well as co-pays for medication at the pharmacy.
Okay. Can I switch my plan if my needs change?
Absolutely, and I love this question. So actually we're coming up into the annual enrollment period. October 15th is when it starts, October 15th through December 7th. And this is my busiest time of the year.
Thank you for being here.
Yeah. Going, especially with our agency, we contact all of our clients every year and reassess. That's whether our clients have had changes, in their health, in their needs, anything like that. But as well, the insurance companies, they're changing, they're adjusting their plans all the time as well. So there's always changes occurring, and we like to go over that. So,
And I think that's huge because there's a lot of do-it-yourselfers, right? And that's cool if you want to continue to do it yourself. But if you want someone that's informed, I think it's a great idea to work with somebody so they can educate you on that. So you guys do that. You'll do that in your office. But for those that aren't able to get out, are you able to come to the home and help them?
Yeah, I travel quite a bit. Our office is in Largo, off of Wilmerton, but I am down here in St. Pete quite a bit. I come to homes as well as meeting in, like a third location, meet people at Starbucks sometimes, Panera, just a little cafe setting, bring my laptop with me. I'm very mobile, so absolutely.
I think that's really important because people don't know all the ins and outs, and being able to have a resource that is willing to come to their home or wherever they feel comfortable means a lot. So, and one of the questions whenever I'm working with somebody that's offering insurance benefits, it's like, I work with seniors. How much time do you allot for the time spent with them? So, Lindsay, what would you say you allot in terms of time when you go meet with a senior?
So as far as meeting with seniors, which is most of my client base right now, depending on what the appointment is for, I allot different amounts of time. And so, especially for my initial appointment, I try to block off a very significant amount of time because I want to make sure that we go over everything. I'm very thorough, especially in an in an initial appointment, I want to go through, what doctors are you seeing? Who do I need to keep in network for you? What medications are you on? What are you going through situationally right now? What does your lifestyle look like? Because those are important things that really affect what plan you're going to be on.
Yes, yes. And so can you enter, I know some of us have a lot of medications that we're on. Can you, so I'm sure you're checking each of those, and can you check that right then and there with them?
Oh, absolutely. Yeah, we have plenty of different software options. There's different websites that are agent access only that I have access to, so we can just basically plug in all of that information that I'm collecting, and I can really tell what is going to be the best option as far as eligibility with all the crossover between doctors, medication, what hospital network do you like, all of those kinds of things.
I love it. What is the best plan on the market?
Oh, so I actually love this question because I get it all the time, probably every single person that I talk to. And so basically the answer to this question is that all of them, or none of them, both really. A lot of people kind of address this in the way that, oh, my neighbor told me that they're on this plan and this plan's really great and it's done wonders for them. And that's true, but I feel like that could be said about all of them. Just depends on what your circumstances are. Kind of like you said about the services that you provide, it's very much about data collecting from that individual to assess their needs and match them with what's going to be best fitting.
She might be small, but she's mighty, isn't she? So thank you, Lindsay, and thank you for having tons of patience to work through all the questions that our seniors may have. We appreciate that.
Absolutely.
Okay, we're moving on along here to Craig with Florida Department of Veteran Affairs. Craig, who is eligible to file for service-connected disabilities?
All right, so obviously veterans, and when I mean veterans, I'm talking to someone who has spent any time on active duty, regardless of the time frame, the length of service, any active duty portion of time. Then we have Reserve and National Guard. Everyone's eligible, but the way service connection works with National Guard and Reserve is it's time on active duty. A lot of times they get federally activated to deploy or even do a training event in another part of the country. If they're federally activated, then that counts towards active duty time. Good way to look at it is every time a reserve or guardsman comes off those active duty events, they get a DD-214. I've had guys come off as a 7 or 8 DD-214s for a 7-8 year period as a guardsman. Those time periods count toward possible service connection. Active duty, and the reason I bring this up is maybe none of us in here are on active duty, but you may know someone, you may have a neighbor that has someone on active duty. Those guys can apply for benefits while they're on active duty, believe it or not. There's a certain time period, it's within 180 days up to 90 days out, and they have to have either a retirement date set or an EAS where they're getting out. That date has to be determined. But they can go ahead and start compiling all their medical records together, come see us, and we'll start the claim. Now, they won't get compensation until the actual discharge. It's called a BDD claim, benefits on discharge date. So those are the eligibility parameters, but what it takes to get a service connection is you need a current diagnosis. You need an in-service event. And you need a nexus or a link, something tying those last two together. And then the VA will decide whether you grant a favorable rating or not.
Terrific. I feel like this is one of the best kept secrets, so we definitely are grateful that you're here today. Thank you.
And all of our service are absolutely free, okay, as well.
Craig, tell us what the PACT Act is and that's spelled P-A-C-T.
PACT is an acronym that stands for Promise to Address Comprehensive Toxins. And I'm a Marine, so I need notes. And you're that important. I don't want to forget anything. So this was signed into law in 2022, a couple years ago. And what it does is it broadens the eligibility and enhances health access, the health care portion. You go in, you get, if you think you were in a toxic environment while you're in service, you go to the VA, you get a toxic screening. They use that data to compile for future benefits, possibly. But more importantly, what it does is I told you about the 3 things you need for service connection, to get service connection: the current diagnosis, in-service event, and the nexus tying that all together. Well, this enhanced the presumptive conditions. And a presumptive condition based on the area where you're in, Vietnam, Korea, and still the Gulf War era. Those locations, there's about 24 presumptions, and this PACT Act expanded a lot of them. So what that means is, if you have a current diagnosis, the VA is already conceding the fact that you had an in-service event, and linking that together was a presumption. So that's the PACT Act.
So I really like examples, and we talked a little bit about my mom's friend in Maryland. His name is Dave, and he served during Vietnam, was exposed to Agent Orange, and now has cancer. So that could potentially be a presumptive.
Absolutely. Agent Orange is a big one. You know, before this act, and there's many cancers that revolves around a couple other illnesses. And if you've applied, or you know someone who has applied in the past and got denied, well, the law changed, you know, and now some of these conditions are now considered presumptive, and we can reapply for you and get you rated.
And are spouses eligible for VA benefits?
Absolutely. Spouses are, if they're living, they're eligible for benefits, and if they're a surviving spouse, they're eligible for benefits. Those criteria for that eligibility varies based on the vet service connection. Some are income-based, needs-based programs, but some that come to mind are if you're a surviving spouse or maybe become a surviving spouse in the near future, there's a thing called DIC, Dependent Indemnity Compensation. That could potentially provide extra funds for you to try to offset the loss of income from that vet. And there are specific criteria. There's no, someone said it in here, there's no one-size-fits-all solution. This is definitely the case when it comes to VA benefits. Your neighbor could be rated a certain percentage. You were in the same unit at the same time doing the same job, and he may be rated a certain percent and you may not. There's really no, there's a whole lot of variables. Spouses are eligible for educational benefits. Even if you weren't eligible for DIC, there's also survivor's pension, and that's going to depend on the veteran's status before he passed. A living spouse is also eligible for, believe it or not, aid and attendance. Not only does aid and attendance potentially take care of the veteran, but if the spouse needs aid and attendance, again, some specific criteria for eligibility apply, but you don't know until you come in and check it out.
That's right. And so that is the benefit that we were talking about. The aid and attendance can help the veteran as well as the spouse with funding towards assisted living. How can I enroll in VA healthcare?
Super easy. And now, like I said, the PACT Act extended a lot of healthcare eligibility. Even if you don't have a current diagnosis, or you know somebody who has potentially been exposed, send them to the VA to get a toxic screening, because that gets you enrolled in the healthcare right there. Any service connection at all, 10%, gets you enrolled in healthcare. The easiest way is to visit a VA facility. They have an office called Eligibility. Bring your DD-214, and if you have a service connection, bring that disability letter with you. If you're starting from scratch, come see us first, because 9 times out of 10, when you go see Eligibility to sign up, they will start you with the process, but then they'll tell you to go see guys like me to file a claim. But either way, don't pass it up. I talk to so many people that, even retirees, they have TRICARE. They work, they have insurance with their work, but yet they're rated. Take advantage of the VA. You don't know what the future holds for you. There's a lot of services that they provide along the healthcare side.
You mentioned the DD-214. What if we can't find a copy of the DD-214? How can we get a copy of that?
Yeah, depending on the era that you served and the branch you were in will depend on where you need to send a standard Form 180. Or you can visit our office, the VA regional office, and not every veteran's records has everything in it. Only if you've ever applied and are service connected will it have the majority of your files. But if somebody comes to my office and wants to fill out a request for a DD-214, if I pull it up and it's there, I'm going to print it and give it to you. I can't say everybody will do that, but visit an office, tell them what your need is, and it'll get taken care of one way or the other.
And so tell us where your office is located.
We're lucky because the VA has 3 separate administrations: the Veterans Benefits Administration, the Veterans Healthcare Administration, and the National Cemetery Administration. At Bay Pines in St. Pete, we happen to have all 3 of those entities right there, and we're located right next door to the main hospital in Building 22, Room 117.
Building 22, room 117. 117? And when do they make an appointment? Do they show up?
Right, good question. No appointments necessary. We're walk-in only. 0730 to 1500 Monday through Thursday. 0730 to 1400 because we like long weekends on Fridays. Now, addition to that, the St. Pete Clinic, we have a representative who goes there every single Wednesday. He's my supervisor, actually. He goes there every single Wednesday. So if that is closer for you. Also off of 19 in North Pinellas in Clearwater, the North Pinellas Clinic, we have a rep go there every Tuesday, same hours. No appointment. Come on in.
And that's really the best place to start, right? Come in, find out what you might be eligible for, and then take it from there, right?
Absolutely.
Awesome. Thank you, Craig. Thank you so much for being here. I just want to make note of, I'm probably going to run over a little bit. Are you guys okay with that? We're still going to allow time for you to visit the vendor tables again, but I want to make sure that we have all of this information covered. Anybody oppose? Okay, perfect, great. All right, we're moving right along to Kevin Hernandez of the Hernandez Law Firm. I hear this so often. I have a friend who's an attorney. Why is it important to consult an elder law attorney?
The main thing that I want all of you to understand today, when you think you may need an elder law attorney, the first question sometimes that I ask people when we meet together, what type of relationship do you want with an attorney? I typically get a deer in the headlights look because who wants a relationship with an attorney? But it's important because you want a relationship with an elder law attorney who has been on this life journey with clients for many years, has safely made sure that clients are properly informed, properly qualified with the tools that they need, and then has safely guided them up what I call that mountain and back down again. So not every elder law attorney has the same mindset. Ours in our firm is one of service, and we want to make sure that our clients have the right tools for their life journey, and that when anything occurs, either our clients or their family can reach out to us as a point of contact so we can assist them in that crisis or if they have a question, and also to connect them with all the other resources like the people you see on the panel and Mary Ellen and so forth. So it's important to deal with an attorney, have a relationship with an attorney that has been safely up that mountain and back so that your journey is a safe one as well.
What services are offered at your law firm?
At my law firm, we provide a varied group of services: estate planning, elder law, asset protection, special needs planning. But I want to focus on the elder law aspects in that regard, primarily in the area of benefits planning for Medicaid and so forth. Those are the services, and to make sure you can get those services in the future, we want to equip you with the right tools. We call them tools. They're estate planning tools. You have probably heard of most of them, but we don't call them documents. Because when you have a document, what do you do with it when you go home? You put it in your file cabinet and you forget it. But when you have a tool, you keep it nearby. And when you know where it is, you know your family knows where it is. When a crisis occurs, they know where to get that tool and they can move forward to help you. So in our office, we provide the elder law services, preparing for that journey, and then safely guiding them primarily in the area of getting Medicaid benefits planning.
Now, somebody talked to me during the break and said, I'm single, I need to know what plan I need to have in place and what are the documents. So listen up. What are the legal tools I need to consider as I age?
Okay, all of us are aging every day. If we're blessed with another day, we've aged a little bit. And all of us, regardless of our age, should have 5 lifetime planning tools. You may have heard of most of them. The most important one in your life journey is a durable power of attorney. But not all durable power of attorneys are the same. You want to make sure yours is comprehensive and that your family members are going to be able to assist you in all areas of your life that it pertains to. The next most important tool is the healthcare surrogate designation. That tool is that the people you select can make medical choices for you when you cannot. The third tool is the living will. I affectionately call it the pull the plug tool. Very important tool for that end-of-life circumstance. If you are in a coma, persistent vegetative state, or other end-stage condition, and 2 of your doctors say there's no medical probability of recovery from that, then your family can make those hard choices to withhold and withdraw treatment and let you go in peace. The fourth tool is the pre-need guardian designation. I call that the spare tire in the car. You hope you never need it, but when you have that flat, you're glad you have the spare tire. This tool would be used in a circumstance where someone has filed a petition to appoint a guardian, and the judge has determined that yes, you are in need of a guardian. This particular tool could be used by your family members to let the judge know who you wanted to be the guardian of your person and your property when you had the wherewithal and capacity to make those choices. Then the last tool is the HIPAA authorization. Very important tool. You may have seen something about HIPAA when you visit the doctors. This particular tool opens doors. It lets you identify which family members can speak with your doctors, look at medical records, not make choices. Those are the other tools. But it's very important, especially if you have children in other states and you get injured. I'm sure you want them to be able to pick up the phone, call the hospital, call the doctor, find out what's going on. But under the HIPAA regulations, they're not supposed to speak with you. But this tool opens the doors. So it's a very important tool as well. And those are the 5 lifetime planning tools that we all should have. Just to finish up with regards to the guardian designation, many of you may remember the Terry Schiavo situation. Happened over 20 years ago. The pre-need guardian designation tool was the one she did not have. When she was injured, I believe she was in her 20s. I recall just a few years ago, when I was in my 20s, that I was going to live forever. So who would have a tool like that? So unfortunately, she was injured, and we know the rest of the story as to how that happened because she didn't have a very straightforward tool. So those are the 5 that we should all have.
And it certainly helps the family to know what the wishes are too, right?
Absolutely. I mean, you want to avoid, in a crisis, the family dynamics as to what mom wanted, what dad wanted, then all the sibling rivalries. Or I remember when you kicked me in the knee when we were 7 and 8 years old. All that comes back up, and that's not the time that you want it to come to the surface. You want to make sure that your family can help you in those crises.
Perfect. How often should wills, trusts, and legal tools be reviewed and updated?
I have a general guidance that I provide to all our clients. Whenever something bad or joyful happens, after you mourn or celebrate, the next question in your mind is, should we call Kevin to see if we need to make any adjustments? That's a general standard rule in your lifetime. Beyond that, with the lifetime planning tools, we tell our clients every 3 to 5 years, consider updating them. I use the example of it's like a loaf of bread. Over a period of time, it's going to get stale and not be usable, especially the power of attorney. If it's an old one, what is the purpose of a power of attorney? Someone, your child, your spouse, is presenting this power of attorney, this legal tool, typically to a financial company, a bank. And what do? They send it to their legal department because they want to protect their interests. They don't want to get sued. So if it's an old tool, they may not have the comfort to give access to this person that they don't know to your assets, to your investments. They want to protect themselves. They may ask you, go get a judge to sign an order that this still is valid. Or the tool may not have all the language necessary for your family members to do what they're trying to do. Remember, not all power of attorneys are the same. And if it's not in there, your loved ones cannot do it. So I tell my clients every 3 to 5 years, think about just updating it so it's an expression of your current intent and desire.
And it's interesting too because you don't really even think about the things that change in your life until you go back and you're like, why did I have them? You know? And so weddings, funerals,
Celebration.
any celebration. I
Absolutely.
love that. Yeah,
Absolutely.
divorce party, whatever. You've got to pay attention to all of that. What does a power of attorney do while a parent is living?
The power of attorney tool, very important. Here in Florida in 2011, the laws changed. And if you have a power of attorney, your agent can access your accounts even though you have your complete capacity. So when discussing this with our clients, I ask 2 questions. Who do you trust? And who do you trust with your money? Because you want to make sure it's the same person. The power of attorney gives that agent that you've identified access to your investments, to your banking, your bill paying, everything, keys to the kingdom. So you want to make sure that it's someone that you're going to trust. And then in that regard, clients ask me, should I give a copy to my children? Should I send a copy to all the kids? I say, absolutely not. Just let them know where to find it when they need it. Because if you give copies everywhere and you want to make a change, it's like hoarding cats. You need to find them, and they may have had a copy and so forth. And family dynamics change as well. You just want to know where it is, let the family know where it is when they need it, and when they need it, during your incapacity primarily. None of my clients want their children or their spouse to touch their assets while they're well. It's primarily when they need help. That's when they want that agent that's appointed to step into the breach and protect the assets and so forth.
That was, we recently did an event and that was news to me. So I just want to make sure that everybody got that. Our family, like we sent out, here's my information. You're my power of attorney and blah, blah, blah. That's not a good idea. So thank you. Just make sure that you tell them where your documents are kept, but you don't necessarily hand those out because they can act on those.
Absolutely.
If mom doesn't have a power of attorney set up and she has dementia, what do we do to make decisions on her behalf to ensure her needs are met?
One of the key things about that word dementia, I don't like to use that word, and I think in the prior panel it came up as well. It's more of cognitive decline. Even when I first spoke to my doctor about my mother, and I said I just used the common phrase dementia, and he corrected me. It's cognitive decline over time. So if you see cognitive decline in your loved one, then you need to see an elder law attorney, estate planning attorney right away if you don't have those tools, because there may be a small window of opportunity to get those tools. But if that ship has sailed and they're clearly in the realm of dementia as we know it, then the only alternative to be able to assist them is a guardianship. And that's sort of the last recourse is the guardianship process, where you get appointed by the court, and then you can assist your family member in their financial needs and their medical needs. But as soon as you see that little change, that's when you need to act to try to take advantage of that window of opportunity so that they have those lifetime planning tools. Because the judge, the guardianship court, wants to make sure that the person, that they use the least restrictive means, is what they call, to have a loved one assist another. So if you have those tools that I've talked about, the judge will defer to those tools if it makes sense to do so. But if you don't, and clearly dementia, Alzheimer's, and so forth, then the next alternative is a guardianship proceeding.
Okay. Who is responsible for debts that are owed after a parent's death?
Good question. I'm going to introduce you to Bill Murray. He passes away. The family wants to know about all the debts that he had. Only his estate is obligated to pay his debts, not the family. So you don't have to worry about that unless, of course, you signed as a guarantor on a document, on a credit card. But barring that, only the estate of the decedent, the person that passed away, is responsible for those debts. And I just want to clarify one thing, if I may, Mary Ellen, because this comes up all the time. Many people are told, or they hear, or they read, that you should avoid probate and get a revocable trust. I like to compare myself to Paul Harvey in the rest of the story, if you remember his radio show. It's the Paul Harvey of elder law and estate planning. Here's the rest of the story with respect to that. A revocable trust does not avoid the debts of the estate. There is Florida law that says if the estate has debts and the person died with a revocable trust, then the trustee has a legal fiduciary responsibility to provide assets to the estate to pay those debts. So when you hear someone tell you avoid probate, just walk away. They really do not know. There's other things about probate that I could mention if you'd like, Mary Ellen, if we have time.
Go ahead.
3 benefits of probate or dying with a will. The first one is the creditors of your estate when you die. Creditors under Florida law have 2 years from the date of death to take action against your estate. None of my clients want their family waiting around for 2 years to see if any creditor is going to file a lawsuit before they enjoy the inheritance. So through the probate process, we, together with the family, shorten that time period from 2 years to 90 days. And the creditors must file their claim within those 90 days. Otherwise, they're out of luck. So I love that because I love certainty and clarity. As a former engineer before I practiced law, I always enjoyed certainty and clarity as best as possible. I'm still an engineer at heart, even though I've been practicing law for over 30 years. Through this probate process, we can get certainty and clarity for the family with respect to creditors. Then they know they can move on. The other aspect is homestead. If someone tells you you should put your home in a revocable trust, for 99% of us, they are wrong. There is no reason to put your homestead in a revocable trust unless it makes specific sense to do so. For all of us, for most of us, when we die and we have a homestead, what happens? The family members want to do one thing with it. They want to sell it. They prefer to get the money than have another liability. Well, this is the thing with regards to homestead. Your homestead asset is one of your most protected assets during your lifetime. No creditor can put a lien on your home unless they're the bank with the mortgage, that contractor that comes into the home to replace the roof, remodel the kitchen, they may put a lien on the property, or the IRS. No one can stop them. But beyond that, during your lifetime, no one can put a lien on your home. It's your homestead. That's the other aspect of homestead that not many people are aware of. We all know about that tax break that we get on our real property taxes, but this is the real benefit, that homestead protection during our lifetimes. But when you die, that bubble of protection goes away. However, when the family wants to sell that home and they get a buyer who is going to get a loan, that bank, that lender wants title insurance to make sure that they are first in line to foreclose on the property if the buyer doesn't pay the loan. The title insurance company wants to make sure that the sellers are actually the actual owners of the property, and that the person who just died, none of that person's creditors can come forward in the future and put liens on the property. So what they request of the sellers is to get a homestead order. And there's only one person in the state of Florida that can sign an order of homestead, and that is a probate judge. And there's only one way to get that request in front of the judge. You can't go down to the courthouse, window number 23, and submit your papers. You can't go to the DMV. You have to, the family has to have opened a probate. And then independently, that opens the door so the family can request the homestead order. And that homestead order is important because it tells the title insurance company, tells the lender for the buyer that the person that died, the home was free and clear of creditors. That person that died has left that home to family members, and therefore, after the death of that person, that protection of the home against creditors comes back up. And that's what the title insurance company wants to hear, wants to see, that all of the creditors of the person that's passed away are cut off from ever putting a lien on that property. And therefore, they can tell the buyer and the buyer's lender, you're free and clear to take ownership, and you're the first person to foreclose, lender, if you have to. Very important. Then, of course, the third aspect of probate is when it makes sense to do so, to distribute assets to your family. Not everyone needs a trust. We have that conversation of when it makes sense to have a trust and when it doesn't make sense to have a trust. And the last thing I just add, if you have minor children, you need a will to identify who would be the guardians if, God forbid, you both pass away. And don't be surprised if you change that several times during your lifetime. My wife and I changed it 3 times. We were like, oh my goodness, how did we put John in as our guardian? Things change in life, and your plan should adjust as well. Thank you for that time to explain that.
Excellent, Kevin. Thank you so much. I feel like you're such a wealth of information. We could be here all afternoon listening to all the tidbits. One last question for you. If I'm the agent through my dad's power of attorney, how should I sign legal documents?
Okay, there's various ways, but I'm going to tell you the way we recommend to our clients. The agent is acting on your behalf. You are the principal. It was your power of attorney. You don't want your agent, let's say it's that son, to assume personal liability because they're helping you. So they should sign their name, John Doe, comma, as agent for Jane Doe, as simple as that. Or you could do it like myself, Kevin Hernandez, by his agent, David Hernandez, who is my son at the table over there. Any of those ways that identify agent, attorney, in fact, that makes it clear that the person that's signing is not signing on their own capacity, is not assuming their own personal liability. They are standing in your shoes on your behalf. So attorney in fact, agent, anything like that. Sometimes people say, should I put POA? That's not necessarily the proper terminology, but if you can get away with it, why not? But I prefer to make it clear, certainty and clarity, attorney in fact or agent.
Thank you so much. That's valuable information. You can send me a bill. Linda, you're up next. And Linda's with Simply Grab Bars. Who needs grab bars?
Everybody.
What should a customer expect from Simply Grab Bars?
Oh, great question. First of all, thank you, and thank all of you for your patience in sitting through all this today. I hope it's beneficial to you, but thank you especially to Mary Ellen and the church. Thank you. What was the question again?
You're fired. What should a customer expect from Simply Grab Bars?
Number one, transparency. Each time a customer calls, the first thing we do is We let them know how much it's going to cost them right up front. I had a customer call me one time and say, is this going to cost me $10,000? I'm like, no, not at all. Our standard grab bar is $129, and that includes installation. So it makes it very affordable.
Wow.
And our motto is install before you fall, which goes back to the first question. Who needs it? Everybody. We use our grab bars every single day because I don't want to fall. As my husband says, he says, if you go into the hospital after a fall, you're not going to come out in the same condition that you are in today. So preventative reasons. A lot of people say, oh no, this is not for me, this is for my husband. It's for everyone because we don't want to have that fall.
So I'm jumping around a little bit here.
Yes.
What are the most common concerns of having grab bars installed for the home?
Yeah, that stigma, that, oh my gosh, I don't want to look like I'm living in a hospital. We have some beautiful grab bars. Our most expensive grab bar is $189 installed. That includes installation. If we're going into granite, marble, or porcelain, there is an additional fee, but those prices include installation. So stigma, let's get rid of that, okay? We're here about safety. Another one is that they don't need them.
And you have various finishes, so it doesn't
Yes.
look so clinical.
Oh yeah, we have a beautiful contemporary bar that has a matte finish, and it's just beautiful. I mean, we've and the nice chrome bars. They have a 90-degree angle, but you know the standard grab bar. They all have the same amount of safety.
Can I just have my handyman or a helpful neighbor or family member provide the grab bar installation?
Absolutely, if you'd like to. If you're going to do that, I would recommend some questions. If you're going to hit one of my pipes, who's going to cover that cost? With Simply Grab Bars, we have insurance up to $2 million. So if we do hit a pipe, which we have not hit a pipe since we've been in business, but I'm not going to say it can't happen because it can. Anything can happen, right? Nobody plans to get in an accident when they go to the store, but it does happen. But is that handyman going to know proper placement? Do they know? We cover all ADA guidelines. We're ADA compliant. We give a recommendation and do the assessment, and you decide how many grab bars you're going to put in that day.
How safe are the suction cup grab bars?
Not at all. They should be outlawed, and if you have them in your home, I recommend that you get rid of them right away and call us now.
Because that's a false sense of security.
It is. The suction grab bars were invented or created for glass movers. You've seen those trucks that have glass, and you're like, oh my gosh, I don't want to hit that truck. Glass is going to go everywhere. Those people use the suction cup bars to move them. That's for temporary use. In a shower, everyone knows there's a lot of what? Anybody know? Shout it out.
Water.
Water. And what happens with anything that has a suction cup? It starts to lose its suction capabilities. So, again.
And you guys do an initial assessment, right? And then determine placement of each one?
Yes. So when our installer arrives in your home, they're going to do an assessment. First of all, they're going to ask you some questions because not everybody needs the same amount of grab bars. For those who are preventative, they're going to want them in the shower. They're going to want them maybe next to the commode, but mostly in the shower. But our installer is going to do that assessment and let you know what they recommend throughout the home. If somebody has Parkinson's or dementia, they might require a few more bars than somebody who's going preventative. Somebody who's coming out with a hip replacement, they're going to progress and get better as each month goes along. Somebody with dementia or Parkinson's is going to decline, unfortunately. So we look at things with a 5-year perspective.
So I've had clients where they're having difficulty getting off of the toilet, and they don't want to get the raised seat, and they're next to a cabinet, and then the other side is a shower. What's another solution for them to get help
Right,
off the toilet?
in that particular instance, Mary Ellen, a standard grab bar that you put on the wall is not going to be an option. We cannot adhere and go into a cabinet because it's not stable enough. Can't go into the shower either. There's something called a swing-up bar, and it goes behind. We install a plate, so we make sure that we're going into the studs. And the swing-up bar is called a swing-up bar because it swings up to get out of the way. And then when you're wanting to use it, it swings back down. So it is out of the way all the time until you're ready to use it.
I love that.
It's a perfect application.
For people that don't want a hospital bed or a bed with rails, but they're having difficulty getting out of bed, what is a solution for that?
Again, the standard grab bar is not going to be a perfect option for that because when you're lying in bed, the wall's back there. You're not going to be able to get that grab bar, right? And the swing-up bar is not long enough either. So what we have, and we have one on display back at our booth, back at our table back there. Please come by and check it out. It's called a signature life pole, and it's a floor-to-ceiling pole. So we can install that right next to the bed, right where you're going to be getting up, and it'll help you get up and get and ambulate out of the bed. And then we would recommend grab bars going through to the bathroom as well. But yes, that floor-to-ceiling bar is a wonderful, it is a little bit more expensive. Again, here's my transparency. It is $550, and that includes installation. And one of the questions, Mary Ellen, is who pays for this? It is private pay. Unfortunately, insurance does not cover it. There are some long-term life insurance policies that do cover reimbursement for all of our grab bars, including the signature light pole.
Well, if we consider the cost of an ambulance ride to the hospital from a fall and then the hospital visit and the rehab visit, it certainly will pay for itself.
Well, yeah, exactly. Prevention.
Yes.
Yeah, it's just like putting oil in your car.
Exactly. Awesome. Thank you so much,
Thank
Linda.
you, Mary Ellen.
We're going to jump over real quick here to Jim Rudolph, last but not least, with Veterans Funeral Care. Well, this is a subject that most of us don't want to discuss, right? But here we are. We're going to hit it. What are the benefits of pre-planning our funeral?
Oh, goodness. First, I would like to say I feel like I owe him $100.
I know. What a wealth of
I
information.
just turned 65, but that's another story for another day. So you said the benefits of pre-planning. My goodness, where do we start? You get to do things the way that you want to have them done. And very normal and sometimes entertaining in our office. By the way, Jennifer, wave. Very proud of her, 19 years in Navy, and she's now an intern funeral director, so big deal to us. We will have husband and wife arguments. I'm sure you've experienced some of that. And their files will look completely different. So they will have special requests. You know, I want to be buried here. I want to be cremated and be scattered. I love to fish. So pre-arranging ahead of time. Number one, you if there's something you really, really want to do, and I'd love to talk to you a little bit later. You know, we had a guy that was a chief of the boat on a submarine, 26 years, and he wanted to be buried in a casket at sea. That's a benefit a lot of veterans don't know about. And we sent him out on the USS Iwo Jima, and his casket was slid off into the Atlantic. And so that's one of those. If you plan it ahead of time, you'll get it the way you want, and if you don't, you're at your kid's mercy.
That's awesome. If someone prepays for a funeral and moves out of state, is it fully refundable or transferable?
Yes and yes. Different funeral homes have different rules for that, but for us, it's if you leave, we kiss you goodbye, we give you a hug. We will also advocate. We'll actually tell you to call us when you get where you're going. We're a member of a group called OGR, kind of embarrassing, Order of the Golden Rule, invitation only, and they pick the good guy in every city. So we will try to help because usually people are moving back to where their kids are. Somebody's died, and now mama or dad will go back. So we'll actually call that funeral home, tell them we're sending them a file, tell them what a big deal a Sergeant Major is, and advocate on their behalf so that, and also make sure that they'll honor the price.
Good, I love it. So when somebody does prepay, who oversees that portion? Is it insurance company, state, federal?
Both. So as the owner of the funeral home, I have a choice. I can either put money in a trust account that the state of Florida manages, or you can use an insurance product. We, 99% of the time, use the trust account because it's more flexible. You can take it to other states. And how many of you guys remember something called a Christmas club? That's the only way we had Christmas when I was a kid, living in Seminole. I went to high school in St. Pete, but I was raised in Seminole. Most of the funeral homes will charge interest on the payments if you take a payment plan out. And I think we're the only ones out there. We've never charged $1 of interest. It's like a Christmas club. Just get your money in the bank, and
Okay.
that feels good.
Okay. If I want services held at my church, do you coordinate with the church, or is it my responsibility?
No, we prefer to be, really funeral directing is event planning. There's what I call front of the house work, which is what her and I do. We're talking on the phones, greeting people, and arranging and planning for events, whether that's in the church, at Arlington Memorial Park. Do some families try to do that on their own? Yes. Do we get a lot of phone calls from people in the middle of the process saying, "Can you save me?" Yes. So you can do it. I wouldn't recommend it.
Same with like beach and park celebrations of life. Those have been really popular. You can coordinate those as well? Can.
We've got a couple of priests. One's a Marine Corps priest that loves to go out and do beach ceremonies. There are companies out there that also assist with, like, when we get through with your memorial service, they turn around and, what do you know, there's some tents there with refreshments and so forth. So yes, there's support, and we can do it anywhere.
Okay. For someone that wants a traditional funeral, can you give me an idea of the cost?
It can be anywhere. Call it $6,000 on up to. There's sometimes when people say, my dad was buried in a solid cherry casket in Kentucky. I fall over dead because I know what a solid cherry casket costs. Personally, I started Veterans Funeral Care 24 years ago. We've never had copper or bronze or mahogany caskets that we show people. Can we get them? Yes. People say, what casket was President Reagan buried in? And we'll tell them. And then we'll tell them it's mahogany. And then we'll tell them what they cost, like a car.
I know.
Then they'll listen to reason.
We hear people working with some places, and it's like $15,000 and more, and I'm like,
and more.
What are you doing?
The corporate ownership of funeral homes and cemeteries in Tampa Bay has now gotten to the point where the Federal Trade Commission has sent all of us letters, and it says there can be no more purchase of private funeral homes, which is me, by corporates unless they sell something. So this is one of the few areas in the country where the Federal Trade Commission has had to step in because there's too much of corporate. And I mean, we hear things like $50,000 and $100,000 funerals, and I go, how?
Right.
But we hear it.
Let's talk specifically about veterans funeral care. What is your specific focus on veterans, and do you also serve non-veterans?
We do serve, I've been a licensed funeral director since '82. In my first 10 years, I worked for a big funeral home in Clearwater. And so I had a lot of pastors and a lot of priests that loved me, and when I went out on my own, even though it was veterans funeral care, I was raised in an Army family. I need counseling for that. But my dad was a paratrooper, and he meant it. So I think a lot of you understand what that means. My dad only asked for things one time. So when I started Veterans Funeral Care, it was because I had been raised around it, and I knew how to speak the language. Not very many civilians know the difference between a sergeant, a staff sergeant, a first sergeant, and a sergeant major. But my brother and I, it was expected that we knew. So it's like learning to speak Spanish. If you work with the military, and sadly, we have the contracts for MacDill Air Force Base, for Central Command, Special Operations Command, and some others, and that's because we speak the language. You know, it's not accidental that we acquired a young lady, 19 years in the Navy. She knows how to speak the language.
And that's really important for those that served in the military. I don't know the rankings, and I know you recently worked with a family that when the daughters came in and realized the position that their dad held, and they didn't know it before until after he had passed.
That's one of, I could have retired, and that's happened a million times. The story she's trying to tell you, you have a good memory. The story she's trying to tell you is that we had a daughter. It's always the 50, 55-year-old responsible daughter that comes in with the parent to help them. And she came in, and this old sailor, he was rolling in. He had his file under his arm, and she said, "This is my dad, Ralph," or whatever his name was. So I quickly looked at his DD-214, and I saw that I had a senior chief in the Navy. And I said, "Wow, Senior Chief, welcome. It's an honor to have you in the building." And the daughter looked at me like, what do you mean it's an honor? And so I said to her, "Do you not know that your dad is the top 2% of everybody that's ever served? Senior Chief in the Navy." She goes, "Really?" I said, "Really?" So at that point, like Jennifer, Blair, I forget, but we gave the Senior Chief a tour. "Senior Chief, how would you like your coffee? Senior Chief, where would you like to sit?" And so later that day, because it was just a couple of months ago, later that day she called me up just bawling her eyes out, and she said, "What I dreaded today turned out to be such a great day. Dad told me I feel like I was on base again." And it's because because on a boat, if you're a senior chief, somebody gets out of your way. Other than the admiral, you know, you are the man. And the daughter didn't know that. And we find the children and the brothers and sisters, they don't know, because these guys won't. Their culture is they're not gonna brag and tell you what their medals meant. So we do.
You do.
We do.
I love that.
When the veterans passed away, we out all the Purple Hearts and the Bronze Stars, because a lot of times it was never told to the children. It's shocking.
And it's not a place that we necessarily want to visit, a funeral home, but their funeral home on Belcher Road has a mini museum for veterans. It is so cool. So if you have an opportunity, stop by and visit. They would welcome you. Thank you all, professional panelists. Thank you all for being here today. You know, it really does take a village, right? There's so much information that was given here today, and I know it's a lot to chew on. Please know that we are here for you. You've got our contact information in the booklet. If there's anything that we can do to help you navigate this season of life, we're here for you. If you would like, I would love to hear feedback if there's anything that we could do to improve this, and thank you for your grace for letting us to run over a little bit more. And we do still have time to visit the vendor tables, but I'd like to bring up Doc Feaster to close us out today.
Wow, what a morning. Good night. My brain is full. This was wonderful. I hope there was useful information for everyone. This has been a wonderful morning. I want to thank a few other people. Craig Wills, I don't know where he is, but he knows everything in this building, about this building, and he helped with all the setup. He was here before anybody. He got this all set up. Chad got the coffee and the snacks. And somebody in particular, Kelly Pinata, has been wonderful. Anything we needed would say, "Kelly, can you print this? Kelly, can you change this? Kelly, how many of these can you do?" and she'd take some fairy dust and put it on her computer, and out it came, everything we needed. So Kelly was absolutely wonderful in
Yes.
helping us.
Yes.
I'd like to thank Mary Ellen and all of our professionals who have been here for taking their time to come and present this information to us. We greatly appreciate it. It's been terrific. They're going to be here for a good while, so please linger, speak to anyone you choose, ask any questions personally, up close, whatever you like. Pastor Bob is going to close us and dismiss us.
Thanks, Doc. Kavod, weightiness, honor. That's what we do for those that we love as they advance. Thank you again for coming. It's been our pleasure here at St. Pete First United Methodist Church to have you here. Again, this is part of what our vision is to meet the unmet needs in our communities. And I hope we've achieved that with you today. Make sure that you take time with the vendors, take time with Mary Ellen, get familiarized, ask those questions that you need that are very important. And I'm going to offer a blessing, and this covers all people. The Lord bless you and keep you. The Lord make his face to shine upon you and be gracious unto you. The Lord turn his face upon you and give you peace. Amen. Thanks a lot, folks.